Sir, shall we start?
Yeah, definitely, sir. Yeah, definitely we can start, sir.
Can start. Shri Dhanvantari Namaha. Welcome you all to the e-learning platform of Indian Institute of Ayurveda and Rasa Shastra. IIAR was inaugurated by Dr. Siddhinandan Mishra sir in 2018 at Ballari. The institute hopes to teach students and Vaidyas the basics and clinical applications of Rasa Shastra. Till date, we have successfully completed course on Maharasa Varga, a detailed discussion from identification to the clinical applications, Rasaushadhis in Kriyakala, a clinical approach, special lecture series on diabetic management in Ayurveda, and advanced course on diabetic complications and its management in Ayurveda. And our upcoming courses are Rasaushadhis in respiratory disorders, Uparasa Vargas, and so on. So today we are here for a guest lecture by Dr.R.Sivakumar sir, who has been my inspiration to practice Ayurveda only. We have seen him work as a wonderful physician in our college. So it is my privilege to welcome Dr. R. Sivakumar sir. I would like to give a brief introduction regarding sir. Dr. R. Sivakumar comes from a family which practices medicine since generation. He is the son of Dr. A. Ramalingam, a graduate and eminent physician from the field of Siddha, and Dr. R. Meenakshi, a graduate and distinguished practitioner of homeopathy medicine, both of being the descendant of renowned families from South India who practice Indian medicine traditionally. Dr. Sivakumar finished his graduation from the Venkataramana Ayurvedic Medical College, Mylapore, Chennai, and did his master's specialization in Kaya Chikitsa from Ayurveda Mahavidyalaya, Hubli. His desire to develop multi-speciality hospital in Ayurveda made him to do his MBA in hospital management from Alagappa University, Tamil Nadu, during the same time of his post-graduation. He is now a notable faculty of the Department of Internal Medicine at Sri Sai Ram Ayurveda Medical College and Research Center, Tambaram, Chennai. He presently holds the post of Secretary for Ayurveda Postgraduates Association, Tamil Nadu. So, sir has a very good experience, and before his internship, he has been practicing Ayurveda. So, coming to his awards, he won the Best President Award for the Rotary in the year 2018 and 2019 from the Government of Tamil Nadu. He has been felicitated with the prestigious Dhanvantari Award. Ayurveda Nakshatra Award was also, he has been awarded with Ayurveda Nakshatra Award by the Ayurveda Graduates Association of Tamil Nadu for his contributions to Ayurveda. His informative articles and videos are available at Chennai Heritage Hospital website, Facebook page, YouTube channels and telegrams. So here we from the team of IIAR welcome you, sir.
Most welcome, sir.
Thank you. Good afternoon, everybody. It's nice to be here in your prestigious platform speaking for your association. I'm very fortunate and glad to be here today. First of all, I'd like to thank our chairman IAR, Dr. Gopi Krishna, and of course my student who is now a fellow physician, Dr. Pallavi, and I would like to get into the topic directly. So, Ayurvedic managements of gallstone. This has been a topic of question for so many years, and even good doctors and excellent physicians of Ayurveda have some hesitance in speaking on this topic and treating such cases. Some people even openly say that there is a lot of ambiguity in treating gallbladder stones, because the understanding from Ayurvedic point of view is difficult, because most of us try to equate this with Ashmari, and we say that it is a kind of Pitta Ashmari and start treating it, which might be successful in certain cases but not always. And if you go to Shastric preparations and the patent medicines available in the market in India, you can see lot of medications on so many disorders. Now you can see for psoriasis there are very good medicines, for even for prostate now recently so many medicines have been launched, especially for prostate, and for thyroid some specific medicines have been launched. And if you come to gallbladder stones, I can point out one or two drugs in the all over medicine manufacturing facilities that we have all over the world, including India. There's no direct medicine, okay, give this medicine for gallbladder stones. No, such preparations are not available. So that tells that we all know that the gallbladder stone prevalence is very high now, and in spite of that we don't have a solution. Even the big companies are still trying hard to bring out a successful formation, but I would say that they have not succeeded because we have not got a product on the market for this gallbladder stones. So this was in my mind right from my UG, and I wanted to do something on this gallbladder. So I was learning, and the outcome of that is why I am speaking in front of you today. So let us get into the topic. Let me share my screen. Hope you are able to see my screen.
Yeah, very much, sir.
Yeah. So, apart from working as a professor at Sairam Ayurveda Medical College, Chennai for the past 11 years, I also hold a hospital in Chennai, which is a 30-bedded hospital. It's both Siddha and Ayurveda and Yoga specialty hospital, one of a kind in Tamil Nadu, particularly in Chennai. So, again, thanks for inviting me. And this is my hospital. It's a 30-bedded hospital. We have all facilities here. We do all the Panchakarmas here, and we have about 9 doctors here, out of which 4 are Ayurvedic doctors. Some of them are my students also. So we as a team work here, and of course in the college OPD also we get many patients of gallbladder stones. So let me not get into much of the details of the anatomy, physiology and all, because you know everything, and there is no as such direct correlation of gallbladder or its stones in Ayurveda. We can say Pittashayam, Pittashmari, but still I would not be very favorable in concluding them as Pittashmari. So you know the structure, you know how gallbladder is. It's a pear-shaped organ. You have stones inside it. Then when the stones are there, you call it as cholelithiasis. When there is inflammation, you call it cholecystitis. When there is stones as well as inflammation, that you call it as cholecystitis with cholelithiasis. And when you have sometimes some patients come to us even after the removal of gallbladder, but still having a stone there. So you would wonder, when the gallbladder is not there, how there is a possibility of forming a stone. But as doctors, you know that the gallbladder, even if it is removed, since the pathology, since the root cause, roga madhu parikshet tatonantaram aushadam, since that is not followed in the modern system, still the formation is very much possible. But since the gallbladder is not there, the stone gets formed in the ducts, and you get cholelithiasis, which is again a complication. You don't have any other way other than going for a stenting. So these are the basic things you need to know about gallbladder and its stones. So cholecystitis, cholelithiasis, cholangitis, when there is an infection which can be coupled with cholecystitis, and when there is stasis of the gallbladder, bile flow, then we call it as cholestasis. So we have many stones in the gallbladder. The predominant ones are the cholesterol stones, and sometimes here in South India we get pigment stones frequently, and rarely it is mixed stones. And cholesterol stones are easily manageable, but it is very difficult to see if the patient has got a cholesterol stone or a pigment stone, because you need to examine the stone which is being passed in the stools, which is very difficult. If it is a urinary stone, you can easily tell the patient to collect it, but if it is a gallstone, when it is passed through the stools, you will not be able to get it as easily as your renal stones. Yes, so these are the common things that we see in the textbooks: age 40, female, increasing age, obesity, certain diseases of the liver, diabetes, then I already told you stasis, constipations, birth control pills. So these are the common things that you see in the textbooks. But in OP, in our OP, when we encounter such cases, when we get into the histories, strangely that there are certain other things that has to be noted down. When the patient has a habit of eating the food urgently without chewing it much, when the patient has non-fibrous, high carbohydrate and low fiber food, reheated oils, patients when they have food frequently outside, and when they have masala foods like bhaji, bonda, vada, samosas, when they have a habit of having this, that too in reheated oils, and who have a chronic constipation, and who take less water, and over fasting. Many people in the 40s who do not take their breakfast, definitely they are about to get a gallbladder stone in the future. So these are non-familiar things, but frequently encountered in OPDs. So you have to note this. Very rarely copper tea can also trouble the gallbladder. So whenever you take a history of gallbladder, see to that the patient is free of a copper tea or any other insertions, any foreign bodies that also disturbs the metabolic arrangement in the body and troubles the gallbladder. So as I already told you, I am not seeing gallbladder stones in the view of Ashmari or Pitta Ashmari. Rather, I see gallbladder pathologies in the view of Gulma. So, Pindidatvat Amurto api Murtatvam iva Samsrayah Gulmam iti uchate Bastir Nabi Hrit Pashva Samsrayah. So, here we can take this as Murta Gulmam in the Parshvasthan. So, that is how we can see this. So, generally in modern medicine we say 5 F's which are frequently encountered in gallbladder cases: fatty, 40, fertile, female and flabby. We have tried in our hospital to see that in an Ayurvedic sense. So, Snigdha, Shita, Staulya, Sukumara, Sri and Shitilangata. So, hope when you get a picture of these things put together, surely the person is suffering or is going to suffer from a gallbladder stone in the near future. So you know all these pathologies. Let me not get into the detail of the modern pathology. And when you see the symptoms, today we are going to see only about gallbladder and its stones and the treatment, not about the infection or inflammation. So I have restricted my topic to gallbladder stones. So we can see them in two broad spectrums. One is asymptomatic, when you go for a scan for something else and then you find out a gallbladder stone. In 80% of these cases, the stone is going to remain asymptomatic throughout their life. You have to understand this, because in modern medicine, as soon as a stone is detected, the patient is suggested to go for a surgery. which is not needed in many of the cases. Only thing is you have to review it, you have to see if it is staying the same or it is growing in size, and then plan for the treatments. There's no necessity to go for a surgery in most of the criteria. And the next topic, broad spectrum classification, is symptomatic cholelithiasis, where you get mild symptoms like some digestive disturbances and up to severe symptoms like gallbladder colic or jaundice, obstructive jaundice. And there can be projectile vomitings, nausea, and you all know about Murphy's sign and Kamala and all other things. So when there is an acute pain, there are certain criteria, and as soon as the patient say that I get such pains, intermittent pains, you can definitely come to know that this is going to be a gallbladder issue. And you can of course palpate the gallbladder when there is a enlargement in the gallbladder, when there is cholecystitis, and there will be muscle guard, there will be tenderness, and the patient may have constitutional symptoms in cholecystitis, whereas in cholelithiasis, as I already told you, there may not be big symptoms, but when the symptoms are there, it might be mild to moderate to even severe symptoms. So these are the major things that have been discussed in modern textbooks. Let me not discuss this in detail, I have told you already. So now we should have a clear-cut picture in treating the gallbladder stones. In our OPD, when we encounter such cases, we have our own inclusion criteria, treatment criteria. So generally, if you see the thickness, if the gallbladder wall is thickened, it is difficult to treat. And when the stone size is below 14 and it is multiple, then it is going to be an easy job for us. If it is 15 to 19 and the patient is very hesitant to go for a surgery, you can definitely tell them to continue the medications for 3 months, see if it is working, and if it is not working, then go for a surgery. And if it is above 20 mm, it is very difficult from our system, because the movement of the stone itself, the movement of the mobility of the gallbladder itself is affected. So there is no question of dissolving or moving or breaking the stone inside. This is going to be a very difficult job for us. In OP, we have encountered stones which are more than 3 cm, but still some patients have remained asymptomatic, but we have advised to go for Dhanvantari Sampradaya. As I already told, single solitary calculus which is big in size is very difficult to manage for us, whereas multiple stones which are less than 14 mm are very effectively managed by us. All these are our clinical expertise, our clinical experience in treating gallbladder stones at Chennai Heritage Hospital, and it doesn't mean that somebody else who is claiming cannot do it. This is our experience, and I am sharing my experience, and out of this 10-11 years of practice, and even this can change in the future, because we are trying some new rasa preparations like Rasa Karpuram in management of gallbladder stone. Rasa Karpuram is available in Siddha as Veera Chenduram. So that we are trying in the latest way, and we are also trying Pravalam in goat's urine. We are processing it in goat's urine and trying in recent cases. So we may come out with much more better results in the future, but whatever we have done till now, I am discussing it. And as I told, symptoms, when there is infection, sepsis and all, it is very difficult for us to manage it, and because there will be systemic involvement and you get other symptoms, and multi-organ involvement will soon set in. So it's better not to take such cases. And of course, when there is an obstructive jaundice also, you can definitely treat it in the line of Kamala and then get into the treatment of stones. Yes. Let us see some statistics of the patients that we have treated at our hospital. You know that male is to female ratio is 1:3, and similar ratios we have got in our hospital. In the predominantly it is all South Indian patients. Some one or two North Indian patients are also there. Some bunch of foreign patients, NRIs who are Indians who are staying in foreign, they are also in this study. And when you see the age criteria, 41 to 50 are most affected in case of females, and 30 to 40 are in case of males. And as I said, many people are remaining asymptomatic. I am saying about the people who come to the OPD. So in that about 350 cases, about 35% are asymptomatic, and some had digestive disturbance, and some had pain, and some had other complications like jaundice. As I already told you, many are having the stones below 0.6 mm, and some of them are having even a bigger size stone. Since we started, we give the treatments for up to 14 mm, so I have given the criteria as 1.5 cm, and above that we have not included in this study, although we have tried to treat some of the patients. And of course, non-vegetarian people seem to have a higher incidence of getting gallbladder stones, but vegetarian also have a possibility of getting it. We should not forget that. And obesity. The BMI, when it is kept below 35, then the patients have a least possibility to get gallbladder stones, whereas it becomes more than 30, then there is more possibility of getting a gallbladder stone. Then constipation. This I have been speaking a lot. Constipation leads to so many issues in the body, and one such issue where gallbladder, see, about 70% of the patients had a history of chronic constipation. So this is causing so many problems in the body. So this Vada Anulomanam has to be done. Apana Vaigunyam has to be cleared in these patients. And as I already told, erratic food is also a cause, and over fasting, particularly in the mornings, are a definite cause for gallbladder stones. Yes. When we come to the treatment principles, so here we say kapha dushti. Because of kapham, there is solidification of the cholesterols in the, which is a major cause in gallstones. So that is happening. So here we have to go for initially a pitta vardakam, which is ushna vardakam, as a, which will cause kapha vilayana. So thereby we liquefy the stones and try to bring them out. As I already showed you in the Samprapti, Gulma Hara Chikitsa is also beneficial here, and we can also treat associated symptoms, because often when we encounter such gallbladder patients with digestive disturbance, you treat the digestive disturbance, you classify them as non-ulcer dyspepsia and ulcer dyspepsia, you treat this ulcer and you get good results, and the patient is devoid of any symptoms even though they have a gallbladder stone. So probably the stone is not causing the problem. The stone has been identified, and the patient equates the stone with his digestive system complaints and thinks that the stone is, the complaints are because of the stone. You treat simply the digestive disturbance, the patient gets better and he becomes asymptomatic polylithiac patient. So it has to be Snehaharam, Rukshanam and Deepanam, and so Ushna Katu Prayokam is the line of treatment that we follow. It can change from patient to patient depending on the symptoms and depending on the stage in which they come to us. This is just for an idea that I am giving. These are mostly favorable in asymptomatic and mild to moderate symptom patients. When you get a patient of severe symptoms, either you exclude the patient, you don't treat them, or you treat them in other lines of treatments. So the kashayams that we try in our hospital are Trayantyadi, which is Turai Poond in Tamil. It's a very effective preparation. And you can just give Varunatwak, or it can be Varunadi Kashayam also, Varunatwak Kashayam or Varunadi Kashayam, because it has a Vedana property. Or you can give Kulatta Kashayam. In many instances, just Kulatta Kashayam itself helps in breaking the cholesterol related stones. It's only an inference, and or we can even try Kulattadi Kashayam. And there's something in Tamil, we call it as Punai Misai, which is the Sanskrit equivalent term is Arjaka, and Arjaka Kashayam is also helpful. I've shown you the photo. Of late, this is becoming a good drug in treating the gallbladder stones. We are trying this recently, so this is giving good results. And when we come to Swarasam or Kalkam, we are giving Brinkaraja Swarasam or Kalkam in the morning and evening before food for these patients when we admit them at our hospital. And we also give Kaidarium. Kaidarium is Kalashakam, which is curry leaves. So that is also giving good results in combination with the above therapies. And Shadharanam or Aurayavardhini can also be added depending on the symptoms. And of course, we are giving Drakshadi in the night. There are certain metallic preparations we use. As I already told you, Rasakarpuram we are trying in the recent past, which is called as Ayaviram in Siddha. Ayakantam is also being tried at our hospital in the recent past. Hajrul Yahud Basmam, which is Badrashma, is also being given for certain patients. And there is a good preparation in Siddha called as Nandikal, which is crab fossil, the calyx of crab fossil. I am not able to find the equivalent term in Ayurveda, so I put Nandikal. Kalnar is Gause Ashma. So that is being used at our hospital for gallstones. So we have been still in research because we are able to achieve about 70 to 75% of success rate, exactly to say 73% of success rate. 27% is still not, we are not able to succeed even in all the criteria, the treatment criteria I put. So those are the inclusion criteria. Even in such conditions, some of the stones are not responding. Probably they are not growing, at the same time they are not shrinking also. There are certain other liquids we try. As I told, constipation, so we also give Hingu Trigunatailam for certain patients, since it is Gulma Hara Tailam, so we try Hingu Trigunatailam. Jambiradi Panakam is a very good medicine which is being produced in Incops. This was told by one of our professors. I would agree, Dr. Pallavi would be very familiar with Dr. Prashant A.S. He is from Hubli Ayurveda Mahavidyalaya. Now he is the principal of the college. So he would frequently suggest Jambiradi Panakam in gallbladder stones. This is now available only in Incops, and that is actually a good preparation in patients who have digestive disturbances along with gallbladder stones. Jambiradi Panakam works wonderfully. And of course we have other medicines like Madhulanga Rasayanam, Jiraka Rishtam, Ajamoda Arkam. So all these medicines we give patients in certain conditions. These are the whole of medicines that we try in our hospital. You also can try all these medicines. And Yusham, in the 3 days that we admit for these patients, we give Yusham, which is with Shigru and Kulatam. So Shigru Kulata Yusham is given, and that is good in such patients in the initial periods of time. And Patyam Moolakam, radish can be given. Kukkuta Mamsam. In many occasions we blindly say in any patient who come to us, we blindly say that you have to avoid non-veg. But in this condition, Kukkuda Mamsam, because it is Kapha Vilayanam, it is Ushnam. So it is Kapha Vilayanam. So Kukkuda Mamsam can be advised in such patients in the initial period to break the stones. And of course, Shigru, Trikattu, Kulattam, Matulungam, all these can be given as Patyam. See, there are so many cases which we have recorded. We have a software, we have 7 clinics across Tamil Nadu. We put all the data into one single software. It's called MockDoc. We try to scan and put the data. We started using this software from 2014 July. Before that, we were only maintaining manual records. This is one such patient which I treated in 2012. Why I am showing a old report is I just want to let you know the recent report of this patient also. So you can see that the patient had obstructive jaundice symptoms. He had bilirubin 3.2, SGOT, SGPT and all elevated, GGT elevated. He had multiple calculus. So I was treating him with certain other medicines. You can see Bringarajam, Arogya and all in the prescription. Patola Mooladi Kashayam was given. Patola Kattuka Rohini can also be tried. This is June 7. You can see this report. There is an evidence of multiple calculi measuring 3 to 5 mm in the gallbladder and gallbladder polyp. And this is 23rd July. You can see few mobile, so multiple to few mobile calculi, and the calculus has become mobile. And then it is, the next report is on October 11. So here it says 2 mobile soft calculi. See, the calculus has become hard and mobile, and now it has become soft, and some of the calculus have already gone. So this is after 4 months of the treatment. And then this report on 6 of 2013, that is almost a year after his active treatment. There is no polyps, there is no stones, but only polyps are visible in his gallbladder, and the patient was not under my treatment after that. And recently in 2020 we took another ultrasound for this patient, and you can see only the polyps existing and there is no recurrence of stone. So almost 7 years after the treatment, the entire family is, because he was an young adult, and now the entire family and his families are all under our care, and he has become a more sort of a friend to me, this patient. Any other complaints he used to call me. So he recently underwent scan, and the scan revealed that there is no stone again after all these years. So this is the efficacy of the treatment, but we say that after 5 years there is a possibility of recurrence of stones. In this patient there is no recurrence of the stones. So this is how we are treating gallbladder stones at our hospital, and this is not the entire treatment. Each physician understands the stones in his own yukti and treats, and some of them are more successful and some of them are least successful. Why I want to present this case and this topic is, you all know, I have already discussed in the introduction that this is being least touched in the clinical aspects, in the doctors who treat it, and in the speakers who address the students also. This is being the least interested topic which is being touched upon. So that is why, since we have treated and since we have data, I wanted to speak on this topic. So hope this was helpful. There's one product from Jammi Pharmaceuticals. It's an old company in South India. They are producing a medicine called as Hepablin. So this was also a part of our regular prescription in gallbladder stones. Of course, that medicine they have not prescribed for gallbladder, but the combinations in the drug was helpful in treating the gallbladder stones. So that also I am revealing here. So with that, let me thank all of you for giving such a wonderful opportunity to address on this particular topic. For I think more than 100 doctors of our field are there. So thank you all. Thank you very much once again, Dr. Gopi Krishna and Dr. Pallavi, for giving such an opportunity. Let us probably after 10 years these things might also change, because we are continuous learners and we may have more researches and more inferences. After 10 years we will try to meet after 10 years once again on the same topic. Thank you all. Thank you.
Thank you so much, sir. Today you have put light on one of such topics where we actually stumble, the budding doctors, we actually stumble to take the cases. Okay, gallstones, all the question marks come over to us. So it was a good session for us. We have few of the questions from our delegates. Can I start asking the questions?
Sure.
So the first question is, cases of gallbladder stones and fibroids are seen together. Please share your experience.
Yes. So in one of my slides, I told you 5 F's and 6 Yes, right? Hope you all remember that slide. So there, if you see that, you can see a very erratic diet and lifestyle had led to that 5 F's and 6 Yes. So I would suggest the same causes for even fibroids. And when you come to Ayurvedic understanding, the same kapha which is getting solidified inside your gallbladder is also solidifying inside your uterus as fibroid, because here also we need to go for a kapha vilayana chikitsa. Here also we see the pathology as kaphaja gulma. So when the samprapti is the same and the treatment would be more or less with some exceptions, saptasaram, trayantyadi, shaddaranam, all these hingutrigunam, all these are even being jirakarishtam, all these are even being given in fibroid uterus. So when the samprapti is going to be the same and only the sthana is different, hope that gives the answer for the question.
Yes, sir, definitely. So the next question is, Punai Misai Kashayam, please specify the plant part which is being used in that.
It is Panchangam. We use the Panchangam because the plant itself is very small and you don't, the exact correlation is you need to get the flowers, but you will not be able to collect it and you will not be able to freshly prepare the Kashayams every day. So it's better to dry the plant on a whole and powder it and make the Kashayam, because you cannot grow that in your own garden. It is very peculiar and you don't find it anywhere else. It is not even found in Hubli or Karnataka, wherever I have seen. So in Tamil Nadu it is available.
Okay. The next question is,
the flowers appearance is like the cat's mustache. So that is why it is called as Punai Misai. Cat's wink is also the English name of this plant. So that is why Punai means in Tamil Punai means cat, Misai means the mustache. So that is why it's called so.
Okay. So the next question is, how to manage gallstones during pregnancy?
It's a very difficult topic. Often in pregnancy, because of the hormones, the gallstones are not disturbing. Even if the gallstones are there, it is not disturbing. If the patient, see, now recently I shared one joke in the FB. Bridegroom is asking for a bride who is vaccinated twice. So now that has become a criteria. Like that, when you are going for marriage, or at least after marriage when you are planning for a child, you should undergo certain tests and see if you are fit enough. So one such thing is to see a gallbladder stone. If you are going on with the criteria. If you are fat, if you are fair, if you are flabby, and if your family has a history of gallbladder stones, or if you have a erratic diet and lifestyle history, if you are working for night duties, all these things, it's better to go for a scan and see how fit you are if you have a gallstone. Once you become pregnant, it is little difficult because the kashayams like Varanadi and all cannot be tried there, because it is all the treatment itself is Ushna Vardhanam and Katurasa Prayogam, so which may not be very favorable when the patient is pregnant, that too in the first 3 months. And in certain cases, the patient, otherwise a healthy patient, develops gallstones after becoming pregnant, because the growing pregnancy puts a pressure on the gallbladder and the ducts. So there is more stasis of the gall fluid inside the gallbladder, and that forms the stones. So that also we have encountered.
Okay. So the next question is, what are the Panchakarma adopted in treating gallstones, sir, in your clinic, that is hospital?
Panchakarma here, we have to go for Ushnam and Kapha Vilayanam. So we can go for Virechanam in certain cases, but not all, because the patient has to be Balavan and you have all the criteria there. So already when the patient, as I already told 6S, Sri, Sukumaram and all, so it will be very difficult to go for Panchakarma treatment. If you are planning for Panchakarma, it can be Virechanam, or it can be any form of lepam that can be used, but Panchakarma will be only in selected cases, not in all cases.
Okay. So if we want to, like, Sharira Shodhana is given, then we can go for medications. That can be done in all the cases?
Yes, if you are having an asymptomatic gallbladder, you can definitely go with all the Shodhanas. As per Kushta Chikitsa, you can go for all the Shodhanas. Then you can plan for the internal medications, because all the Shodhanas will put the metabolism back in track, and then you remove the whatever has formed, you remove that alone. You don't need to worry about the further formations, because you have corrected the metabolism.
Okay. So the next question is, do you have any experience with the use of Tamra Sindura?
No, we have not used Tamra Sinduram. We don't use that in our hospital.
Yes. Okay. So the next question is, if solitary gallstone of maximum size of the stone, where we can treat, means how to treat that?
No, I told you already, if it is solitary also, below 10 mm, definitely it is easy. Up to 14 mm, you can take risk. 14 to 19 mm, you have to inform the patient that this may work or may not work. If the patient is ready, okay, I'll wait for 3 more months and see if it is working, I'll go with your treatment, or I'll go for the surgery. Right now, I'm not in a situation to go for a surgery. Then inform the patient and start the treatment. Take the consent. Before 10 mm, you can just blindly start with the treatment. This will definitely respond, even if it is a solitary calculus.
Okay. So the next question is, experience on olive oil and lemon juice as used by many people for cholelithiasis.
Yes, olive oil with lemon juice is forming a buffer, and see, when you give a lot of fat, see, many people, now you would have heard about the keto diet and all, no? So they take a lot of fat, they take butter coffee, they take eggs, 2 to 3 eggs in the morning, they take one cheese, one piece of cheese every day, they take a lot of paneer every day, but still they lose weight. You are actually confusing the body, and the body starts to metabolize the fat more than your carbohydrates and other things. The same way, when you give a lot of oils inside, your gallbladder is going to pump a lot of fluids to digest the oil, right? The gallbladder is nothing but it is a storehouse of your bile juice. Okay, so the gallbladder has to compress completely and throw off all the fluids into the intestines to digest that fat. So if your gallbladder stones are soft, and if it is below 5 mm, because the lumen is 5 mm, so up to 5 mm the stones can easily pass. So if that is the criteria, this might work. I'm telling you, this might work. It's not olive oil, it can be any saturated oil, it can be even ghee. Like that we go for Shodhanam. So when you give such ghees, this gallbladder can compress and throw off all its contents, thereby the stones will come out. If it is bigger than 7 mm, 10 mm and all, there is a chance that it blocks the duct and you get into complications. So in that cases, you should not try such treatments.
Okay.
There are a lot of treatments with apple cider vinegar. Now it's very famous in YouTube and all, trending in WhatsApp and all. If you have gallstones, take apple cider vinegar. Yes, of course we tried with apple cider vinegar. That is also giving certain results. Because in certain preparations, like I've told in borax, vengaram, so in that preparations we purify that with vinegar only. So in that way, probably apple cider vinegar is also having an effect. But we have not tried it in much because we don't have references. We don't want to go for all these conventional methods which are there in internet, because there will not be any difference between a normal person and an Ayurvedic scholar. So we are not trying that.
Yes. So the next question is, are kshara like yavakshara or molika kshara not useful in kapha vilayana in these conditions?
Definitely. Definitely ksharas will be useful. We can definitely try ksharas. That's why I said we are using certain ksharas. As I told, one of the preparation of the hepablin, there is a kshara, yavakshara in that. So we are using that also. Ksharas will also be useful. Definitely we can try ksharas.
Okay. Sir, have you faced any of...
Because why we are not using ksharas is, ksharas are definitely useful, but certain patients do not find it very easy to digest them because already there is an indigestion, and when you give ksharas, there is much more indigestion that happens. So if it is ulcer dyspepsias, ksharas in that case will be helpful. If already there is a delay in digestion, you give ksharas, it will delay the digestion much more and the patient may have some more symptoms. So you have to understand the situation and you can definitely prescribe ksharas, not a problem at all.
Okay. So the next question is, have you come across any complications during treating these cases?
Yes, as I told you, asymptomatic gallbladders become symptomatic in between the treatment. So that is a big problem. So that time only you need to go for the other liquid preparations that I have given, no, Madhulunga Rasayanam, because the patient may have vomiting, projectile vomiting. You may need to give Dhanvantara Thailam for external application, fomentation. Then you may need to give Karpuradi Thailam for external fomentation to relax the gallbladder, because when the stone is getting obstructed into the lumen, the gallbladder gets contracted. When the gallbladder gets contracted, then you get all the biliary colic symptoms. So to remove from them, you can try any antispasmodic medicines like Ajamodam. Even one drug in Himalaya called the Himcospas is helpful in these conditions. And in Solimix, there is a medicine called as Myostal, which is actually for pains. But in these spasms, we have tried the Myostal. It is definitely effective in managing the spasms. So in such conditions, we can try from our side, but once it goes beyond control, when the bilirubin is steeply increasing and the patient gets all the symptoms of obstructive jaundice, and if you are not able to manage that, it's better to go for a surgery. Emergency laparoscopy has to be done.
Okay.
There are limitations. We cannot say that we can successfully treat gallbladder.
Okay. Sir, if there is a case of gallstone and pancreatitis, how to manage the condition?
It's difficult. It's very difficult because again, it can be pancreatitis can be because of many reasons. It can be because of even gallbladder. Pancreas can get infected. A post gallbladder infection, that is cholangitis and cholecystitis leading to pancreatitis. It can be any other thing which can cause multi-organ damage inside the system. So in that cases, the patient will have very much, if it is a chronic pancreatitis, we can definitely treat with Pipali, with Aparajitam and all. But in acute cases, definitely very difficult.
Okay.
Acute pancreatitis with acute polylithiasis or polycystitis or symptomatic gallbladder is very difficult. We don't take such cases.
Fine. Sir, in acute pain conditions, acute colics, how can we manage through Ayurveda?
No, I already told you, no?
Yes,
Certain things we can try
Dhanvantaram.
from our side.
Yes.
I told you the medicine names. I told you the external applications. And in modern system also they say that complete fasting, just water alone to be given for next 24 hours. This is being accepted by modern medicine also. We also start with upavasam only, fasting only, most of our treatments start. So modern system also, in this particular condition, they say that if there is symptomatic gallbladder with signs of obstruction, you need to relax that gallbladder and throw the stone back into its body, not in the lumen. So in that case, you have to give complete fasting. You have to give only water for that patient. Along with that, you give the external applications and internal medicines. We will see good improvements in such cases.
Okay. Sir, you have mentioned a medicine from Jami Pharma.
Yeah,
Can you please repeat that?
it's called Hepablin, Hepableen. So that's actually, you are asking for spleen, no? You are asking for pancreas. This medicine they have been prescribing for spleen, gallbladder, liver and pancreas. So it is full of rasa aushadhi only. I think I have a slide of Hepablin. I'll just see if I have.
Okay.
No, I don't have.
Okay, no issues.
Any other questions?
Yes, sir. I'll just. Okay. Sir, in clinically asymptomatic cases, can we neglect treatment in such cases, or it might lead to any complications in future?
Yes. So that's what I was saying. If you were already asking me a question, if a pregnant lady comes to you with a gallbladder stone, what is your status? In such cases, closely watch and try to give the medicines that are possible, because Shadharanam can be given, Varunatwak alone can be given weekly once. Like that, some medicines can be tried in even in pregnancy. Okay. Or if the patient is hesitant to take medicines, you tell them to come back after 3 months with a fresh scan. See if there is any interval change in the stone size. If there is no change, tell them to wait another 6 months and do a scan. There is no change at all, likely this is not going to disturb him at all in the future. But advise him for lifestyle changes, tell him to reduce fat, tell him to make his body fit, tell him to bring his weight under BMI 25. So all these things you advise. Okay, so that the Nidanam is being removed, so that whatever has formed will stay and that will not disturb, and whatever is about to form, that we have prevented by following all these changes in the diet and lifestyle. So that we can do, definitely we can do. It need not be treated. As I told you already, for all patients it need not be treated. And for some, as I already told you, for some of the patients, you treat the associated symptoms of GERD, of gastritis, of gulma, acid peptic disorders. That itself makes the patient better. You don't even need to treat the gallbladder stones. The patient understands that all the symptoms are because of gallbladder. But you treat all the other symptoms, gallbladder becomes asymptomatic. Probably that has been there for so many months and that is not disturbing him.
Okay. So there is one more question. How can we treat gallstones in the old aged people?
There's no harm in treating gallbladder in old age patients with the same line of treatments, because as I already told you, the incidences in old age is going to be lower. Out of 10 patients of gallbladder stones in OPD, you are probably going to see 1 or 2 above 60. Okay, so you don't need to worry on that. If at all it happens, it means that the criteria is the same of how you treat a 40-50-year-old. The same dosha dushyam is samurchanam is going on in the 70-60-year-old also. So you can still apply the same treatment there.
Okay. So the next question is, after cholecystectomy, how can we manage?
After cholecystectomy, see, gallbladder is a storehouse. It doesn't produce anything there. It is only storing there. So when your liver is able to produce and supply, you don't need to have your gallbladder as such. That is what is the vadam of the modern doctors. You don't need your gallbladder, your liver will take care all these things they say. My guru, Dr. L. Mahadevan, also feels that many of the patients who have undergone cholecystectomy remains asymptomatic in the rest of their life. But there are chances that these people may also develop if the stone formation is very active. In such patients, if you go for a cholecystectomy, the stones may get formed in the main duct, in the hepatic duct or in the bile duct, and then it causes a problem. So there are recurrences, of course, and if it is not completely blocked, you can follow the same treatment. If it is completely blocked, you cannot do anything. You have to go for a stenting inside the duct, and that can be, of course, that we cannot do that. We have to suggest that to a modern doctor. There we cannot remove gallbladder because already gallbladder is removed. So they will advise you only for stenting. We cannot cut that duct.
Okay. So the next question is, what is the Aushadha Sevana Kala in gallstones? Is it the Samana Kala or any specific timing?
That is a matter of research. We have not still given any medicine with such Aushadha Kala in mind. We generally give some Aushadhis like Shadaranam in cases of biliary colic and all. We try to give them in Muhur Avastha. So only that we are following. Otherwise, we are trying to give medicines before food, certain medicines before food and certain medicines after food conventionally. But we have not got deep into it. I don't have any data on it.
Okay. So there are questions popping up back to back. So this would be the last question and I'll close it, sir.
Okay.
How we will stop formation of gallstones after some symptoms are seen in the patient?
See, I already told you 5Fs and 6S. Try to remove them. Certain things are not removable. If the patient is fair enough, you cannot tell him to stand and get tanned. That is not possible. But the other things, as lowering the BMI, having a healthy lifestyle, having a breakfast, solid breakfast. Many people take Kellogg's and drink some oats and finish off their morning breakfast. That is very dangerous. See, I always keep telling, your first digestive agent is not your gastric juice. It is your saliva. So utilize it. Saliva is going to make your food more safe for your digestion. It is going to remove harmful bacteria and viruses from your food. It is going to make the acid base balance. It is going to control that balance. So if you put more saliva into your food, which will happen only when you chew, then everything will be normal. If you don't do that, that is what in the Nidana, in the OP encountered causes, I have put one thing where people do not chew the food properly. So this is very important in bile stones also. Those who have a habit of taking food very fastly, very quickly, these people also get gallstones or any other digestive disorder. So these things have to be changed. Nidana Parivarjanam is important in our treatment. That is the Pradhana Chikitsa. No? So first we have to adapt that. That alone will do in most of 80% of the patients. If it is not done, then we have to treat it with medicines.
Okay. So these are the questions, sir.
Okay.
Thank you so much for a wonderful
If anybody
session.
has any question, you can see my
Yes,
WhatsApp
I'll just
number.
post it to you.
Yes,
Yes,
you can
definitely.
send through WhatsApp or email.
Yes, sure.
I'll be glad to answer your questions. Or I
Yes.
think this will be in the FB, right?
Yes, yes, sir.
FB page. So
Yes.
if any questions are posted there, I can answer there also.
Yes, yes, definitely, sir. This session I'll tag you so that you will also get the notifications when questions are asked. Yes. I request Gopi Krishna sir to just speak few words and conclude.
So thank you very much, sir. It was a very good presentation. And as initially said by Dr. Pallavi, it's one such topic which many people don't go to touch. Because many times people think so, like there is no difference between cholelithiasis and as well as with that of the renal calculi. They feel so like the treatment module is the same because of both the way it is calculi, but for us it is something different. The way how we analyze the thing is totally different. The way how we approach to a patient is different. And you said about your clinical experiences by observing your own way of the people who are being more prone to have the cholelithiasis. But some people do still land up into lots of complications. Many people neglect this. Many people are asymptomatic. But there are so many ways which you have explained for making it to become more awareful and also get it treated in a proper way. And so goes the treatment, and this is a fancy of Ayurveda. So that's really great session. It was a splendid thought process for us to have a new dimension of the whole treatment protocol of the cholelithiasis. So thank you very much, sir. We expect more of the sessions from you even in the future. Be linked with Indian Institute of Ayurveda and Rasashastra.
Thank you. Always. When I studied in, I did my UG in Tamil Nadu and PG in Hubli.
Yeah.
So the atmosphere was very different in Hubli, and the doctors there at Hubli never see the students as students. They give equal respect, particularly Pallavi knows doctors there, including Dr. Prashant. So that experience with Dr. Prashant, Dr. Sanakal, Dr. Hullur, Dr. Subhana Gowda has given a lot of expertise. And basically my father, as you all know, is a Siddha graduate. He was working for a central government under cancer research. So our hospital is also popular here for cancer treatments. That is done by my father. In stage 1 we are trying to treat, stage 1 and 2, 3 and 4 is a little difficult in many cancers, particularly in leukemias we are getting good results. So we are documenting all those things. So I'm once Pallavi called and told that you have to speak for our association, I was very happy because coming back to Karnataka, it's coming back to Hubli. Those are good days that we had in Karnataka.
Definitely.
Thank you very much for inviting me, and if at all any session you want, we will definitely have, and I'll also try to invite you for our associations. We have NASIA. I am part of NASIA Tamil Nadu. I am a treasurer here. I am a part of All India Ayurveda Congress, and I am part of Ayurveda Postgraduates Association of Tamil Nadu. So we have 3 associations, and we are also conducting certain online sessions. So we also recently opened a COVID center separately and managing COVID patients through NASIA. So we are doing that. Our president, Dr. Jaikar, he did his MD Rasashastram from Gadak. So he is managing the center with many Rasa Aushadis. So that is going on successfully.
I used to visit Jayendra Saraswati.
Oh, great. That's nice.
And every year we used to host a national conference in Ballari, and the hosts were basically from Jayendra Saraswati.
Oh, great.
It was Ramdas sir who has totally taken initiation, the principal of Jayendra Saraswati.
Ramdas Maganti sir.
Yeah. So we had almost 70 to 80 delegates from Chennai team.
Okay.
come over here, stay here for almost 4 to 5 days.
Okay.
We used to host lots of sessions here.
Okay.
So
I had
it was
been
an-
to Bellary in 2008-9. Bahiri Parimarjana Chikitsa. I had come to Taranath College.
Yeah. Okay.
I'm in contacts with some of the students there still now.
Oh, okay. That's
And
great.
I'm very close to Dr. Madhav Digavi also.
Oh,
Yeah.
okay. Yeah. So very nice to have you, sir. We are expecting more of the sessions even in the future.
Sure, definitely we'll do it.
For the information for all the delegates, as informed by Dr. Pallavi, we'll be hosting with lots of the sessions with expert panels. Be linked with our Facebook page, and also do visit our site www.iiar.co.in, and wherein you'll be having lots of details. We have lots of webinars being hosted this month. Almost nearly 15 to 20 webinars were being hosted, and we are having more of the emphasis of the most expert panels in India. So do get yourself linked with our group or our institute, and also we'll be hosting more of the courses by the next month. We'll be coming up with the respiratory crisis and the Rasaushadis. Also we'll be coming up with the Uparasa Vargas and clinical managements. We have more of the things to come across. By anyway, be visiting our Facebook page as well as the website for more details. Thank you very much.
Thank you all. Thank you.
Recording stopped.
Okay.